my name is Maria Titskari and I'm from Greece and interventional radiology, working in Greece. I'm also a member of the ETF subcommittee. And we have the pleasure today to have here with us Professor Kraina from CIRSE University Hospital, that he's pleased to provide for us a short interview about his upcoming lecture in CIRSE Summit 2020. Professor Kraina is a well-known interventional radiologist and very active member of CIRSE. And actually, he was the first one to introduce TIPS procedure in Czechoslovakia back in 1992. In recent years, his research and his main clinical interest, though, is focused on endovascular therapy of stroke. So, Professor Kraina, welcome, and thank you once more for being here with us and accepting this invitation.
Thank you.
So, during the CIRSE 2020 Summit, you will be speaking on acute stroke management. Can you please tell us why is it important to feature this topic in this upcoming summit?
Yeah, that's very important. I mean, you know, the endovascular stroke therapy achieved a very high benefit for patients. So now we need to treat, in average, more than 2 patients to have 1 independent. This benefit is non-comparable with any other method. So I think that this therapy is not only question of successful recanalization. However, there is logistics, assessment, clinical assessment of these patients, and also organization of the diagnostic process, which is at the same level as the recanalization. However, the recanalization last 5 years achieved tremendous advancement, and it's crucial. So, I mean, this is why it's important that international radiologists, not only international neuroradiologists, should be involved in this kind of session. Yeah.
My next question is, who do you think should watch this session?
In every CIRSE meeting last 5 years, there are sessions dedicated to acute stroke therapy. And there is no country in the world having enough doctors who are experienced and skilled enough to cover 24-hour service. So we need, beside international neuroradiologists, also the other interventionalists to help with that and to cover the whole week, even during the summer and the vacations, this service. So therefore, I would recommend strictly also to see these sessions about stroke, interventional radiologists. Beside that, these sessions had been always very well attended. So I mean that the program planning committee is aware of that, and this it's not only this session, but the others, I do believe will be very well attended as well now.
That's good, thank you. And what take-home points can people expect from this session?
I mean, the session which I will be presenting new about the technical stent retrievers will present something which probably the aspiration thrombectomy is now preferred method of mechanical thrombectomy over stent retrievers. Also, the combination of both techniques could achieve something which we today call first pass effect. This will be also how to manage the patient regarding the general anesthesia, since I mean that's additional issue which will be or should be organized during the procedure. And finally, about the differences between posterior circulation and anterior circulation. Posterior circulation is, I would say, less sensitive to the ischemia, and however, there are also the studies prove that mechanical thrombectomy is at least as good as the best medical therapy.
We're waiting for CIRSE Summit 2020. We're excited for this meeting. And thank you once more.
Thank you very much, and for invitation, since I mean, as I mentioned, this therapy provided also by international radiologists in European countries. It's something which is one of the most beneficial to our patients.